Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide the COVID-19 pandemic update with data accurate through November 24th, 2021. I want to start by wishing all of you a very happy, enjoyable, and healthy Thanksgiving holiday. This week, as I've done in previous weeks, I'm going to try to cover the news in 3 minutes, cover those things that I think are important that I've watched happen in the past week. Certainly, FDA recommending the booster, this possibility that we're entering a new upsurge in cases and hospitalizations, the fact that more people have died from COVID this year than last, and then a systemic review that got a little bit of attention in the news, but not a great deal. I'm going to start my timer now. So obviously the first big news is that the CDC and FDA recommend boosters for all adults. Not a great deal of data has come out on it, except that they're saying that anyone 18 or older who's 6 months after the Moderna or Pfizer vaccine or 2 months after the J&J vaccine should receive a booster. And the FDA says it helps to provide continued protection, including serious consequences, preventing hospitalizations and death. And the CDC says basically the same thing. The boosters have demonstrated the ability to safely increase people's protection against infection and severe outcomes. Implicit in all this is really that we don't really understand how long immunity against COVID lasts, either from natural infection or from immunizations. It does appear that immunizations are more effective at providing long-term protection than natural disease, as we've discussed before. The second issue of importance is that we appear to be seeing an upsurge in cases and hospitalizations. And this is quite concerning because it's happening before the Thanksgiving holidays. We sort of anticipated that it might happen after it. If you look globally, you can see an upsurge in cases there on the right side, right over here. We're not seeing the same pattern with deaths. It may be coming up slightly or staying level. There have been over 5 million deaths. But the important thing to notice is that even if it's not coming up, we're still seeing about 7,000 deaths a day, many more than we saw in last summer. The same is true with the U.S. We see this upsurge in cases on the right, no particular upsurge in deaths, maybe a slight increase, almost 800,000 deaths in our country and about 1,000 deaths a day. Now, when you don't know exactly what's going on, the best thing to look at is hospitalizations, and it does appear that we're starting to see an increase in hospitalizations both nationwide and in our region, the Ballot Health region. It's been reported that more people have now died of COVID-19 in 2021 than in 2020. Of particular concern, though, is that the pattern seems to be changing. Last year, it was mostly people over the age of 65. That was 81% of the deaths. This year, it's 69%. And we've doubled the number of deaths in people under 45. So it's changing. It's also changing where it's occurring. Highest death rates have been due to in Alabama, Florida, Mississippi, and Tennessee. And again, the big change, of course, is the difference between vaccinated and unvaccinated people. And according to the CDC in September, the risk of dying from COVID was 14 times greater if you're unvaccinated. And of course, if you follow the occurrence of the disease, again, it occurs in different places and different times. I'll come back to this perhaps next week, except to suggest that this constant recurrence of spikes seems to be a real and consistent pattern. I don't really have time to cover this meta-analysis, except to say that I was excited when I read that it showed that social measures, including hand washing, masking, and physical distancing, are effective. But there was an editorial that came along with it, just to very briefly say, considering the importance of these types of measures, the immense amount of research that's gone into vaccines and drug development is great, but it's concerning that so little has gone into more systematically measuring these public health measures. We'll talk about that perhaps more in a future week. So again, these are the things I've been following this past week. A great deal more information about COVID-19 on the College of Public Health website. If you know anyone who'd like to be added to our mailing list, please contact Jan Stork. I'd like to thank Dara Young for editing, producing, and posting these videos. And as always, if you have any questions about this vaccine, the current upsurge, any issue around COVID, please let me know. I look forward to hearing from you. Until next week, please be well. Thank you.